Mr. Krishnamoorthi has a couple things.
Yes, I just wanted to do a little bit of housekeeping here. First, I want unanimous consent to enter this article by the World Economic Forum titled, quote, "New Research Busts the Myth of Welfare Dependency," which summarizes economic research showing the belief that social safety net programs cause dependency is not based on reality and nothing more than a misleading myth. I'd like to enter that into the record.
Okay, we'll do that.
And then I'd like unanimous consent to enter into the record a report by the Center on Budget and Policy Priorities titled, "Medicaid Work Requirements Could Put 36 Million People at Risk of Losing Health Coverage." This report estimates 36 million people could lose Medicaid coverage if Republicans condition health coverage on a variety of requirements that are currently under consideration by the Energy and Commerce Committee.
Thank you. We'll enter that into the record. Now we'll ask you if you want to do a closing statement.
Yes, thank you very much. Thank you, Mr. Chair, and thank you to our witnesses for devoting your time, and thank you to the audience for your attention as well. First of all, I was moved by the different stories, personal stories, your own, Ms. Onwuka, as well as Mr. McGuire and Mr. Bell and Ms. Simon. I think that where social safety net programs work, they're transformative, and they enable people who are in real need to overcome that need and do great things and to live the American dream. However, I will be the first to concede that there can be improvements, but can we do these improvements? Can we work on these improvements in a thoughtful, bipartisan manner? I think the answer is yes. And so, for instance, with regard to work requirements, which Ms. Onwuka talks about, I think that more Democrats would be interested in working on this issue if they also heard about potential supports with regard to career technical vocational education that enables people to get the skills to acquire and keep the jobs that are out there in the workforce that we need them to fill. I think more Democrats would also be very interested in working on this issue if we could talk about the issue of child care, which is dramatically scarce, not only for poor people, but for all people. I think everyone in this room who has ever had to pay for child care knows how prohibitively expensive it is, and how we talk about a marriage penalty. There's a child penalty in this country right now that is operating to, in my opinion, really discourage family formation and discourage all the things that we want good to happen in this country. So I would just respectfully submit, Mr. Chairman, that if we could also talk about these issues in the context of the ones that you are talking about, I think we could really have a thoughtful discussion. Finally, I respectfully submit cuts of the magnitude being contemplated in the Energy and Commerce Committee or the Ways and Means Committee, cuts to the tune of $2 trillion to Medicaid, would absolutely be devastating to the tens of millions of families, especially on Medicaid expansion, who are benefiting from those supports today. In my home state of Illinois, about 700,000 to 800,000 Illinois residents are on Medicaid expansion. Are many of them able-bodied adults? Absolutely. Are many of them working? Yes. Are many of them incapable of affording private health insurance without these supports? The answer is absolutely, positively yes. That is why they crucially depend on Obamacare. They crucially depend on it. And so if we're going to take those supports away from them, they will not have access to health care, plain and simple, even as they continue to work, even as they struggle, even as they raise their children. So that is the question on the table for my good friends on the other side, which is, I understand you are looking for places to find money. I respectfully submit, do not find money on the backs of people, poor working people who cannot get access to health care in any other way than through Medicaid and these crucial safety net programs. With that, I want to say thank you, Mr. Chair, for your indulgence, and I yield back.
Thank you very much.